to the important topic which we are taking today in order to better prepare and enhance our understanding on the topic of pandemic preparedness. At the outset, let me introduce the two distinguished speakers of today's webinar. Professor Mohan Tanniru is a professor at the Division of Public Health and Practice at the Mel and Annette Zuckerman College of Public Health at the University of Arizona. He is also senior investigator of the Global Health Initiative. He is also associated with the Henry Ford Health System, Detroit, and emeritus professor of MIS at the Oakland University. My second guest for today, Dr. Mohan Tanniru, is a career civil servant and has handled multiple civil problems in the state of Gujarat, including pandemics such as the Gujarat plague, the Surat plague, the Bhuj earthquake, etc. As is in his career in the Indian Administrative Service, the IAS. And one of the reasons why we invited him to today's session was that he anchored a statewide CSR action as CEO, the Chief Executive Officer of the Gujarat CSR Authority. Gujarat CSR Authority today is a role model before the country, how government and corporations can come together and undertake variety of actions, both in terms of civil supplies, medicines, including mobilization and other interventions in order to meet variety of problems, including pandemics. Therefore, both of you are here. Dr. Tanniru, Dr. Tiwari, both of you, welcome to the webinar.
Thank you.
Thank you, and good evening.
So, let me start the conversation and pose my first question to Dr. Tanniru that to our audience, please tell what are the global trends of COVID-19, because that's what is on top of our mind today. And we want to begin with that because that's the immediate trigger why we are having this webinar. So please give us a sense of the global trends and how it is impacting life in the US, because that's where you are situated right now.
Thank you. Well, there has been a lot of discussion on global trends in general of pandemics, but I think there are some links I have provided underneath the presentation here on the slide that is quite extensive information. So I don't really know whether I need to revisit that because I'm sure a lot of you can go through them. But at least in COVID, we have seen its evolution from China, then to, of course, South Korea and Hong Kong and Taiwan, and each one managed their own effectively to some degree. And of course, now they're seeing the second wave. And of course, then to Europe and now to North America. So the bottom line basically is COVID actually it's a relatively new virus that not many people are aware of or not many people have seen before. So it has spread, and there is really not a whole lot of preparation that we could engage in. However, I think anytime you have a pandemic, just from a US point of view, we are ourselves, just like many countries, are somewhat unprepared, in my view. Obviously, it has impacted, just like every other country, it impacted, of course, our employment situation because a lot of the service industry and then eventually the manufacturing, other industry have been impacted. So our recession now, our employment, which is actually growing at significant rate since 2008 recession, has reached the same level as what we were in 2008. So obviously we lost about 28 million jobs, which is significant considering it only happened in about a month. And, it has impacted, of course, the healthcare. But again, we are very unprepared in many ways. And that affected, of course, the way we could address it through equipment and others that many hospitals are having difficulty. and testing is becoming a significant issue. And of course, that is a major challenge for a lot of states. And I think socially, of course, it changed the entire life because obviously U.S. is much more mobile and very uh, kind of diverse in its one activities, and it has growing significantly. So I don't think our impact in U.S. is any different. I probably you think you know more about this through newspapers and others, but the reality is, in my view, we are just not as prepared as we could have been. But that's again, we'll come back to that later. Proceed.
Right. So, Dr. Tiwari, what are your first reflections on the state of COVID globally, India, and how do you see situation emerging and how it is impacting? Let me invite your first reflection on this topic, Dr. Tiwari.
Dr. Sharma, this is the biggest crisis of our generation which we are facing, and I don't think any country was prepared to handle this kind of pandemic. And I believe few months ago, the Bill and Melinda Gates Foundation had carried out a simulation, and they came to a conclusion that neither the bureaucracy, nor the country, nor the health administrators are ready to handle any major pandemic. And we are at this situation now. But as far as India is concerned, surprisingly, we are doing much better, and surprisingly, central government is taking a very coordinated, approach, which is very, impressive, because various government departments keep on, arguing with each other, dissipating a lot of energy. But in this case, if you see that the Ministry of Health and Family Welfare and Ministry of Home Affairs, they are coordinating very nicely things. And another very good thing was that the public dialogue was initiated well in advance, which has created, to a large extent, voluntary compliance with the government instructions about the be it lockdown or anything else. Another good thing was that the guidelines are practically, for everything, guidelines are available. So government, the kind of speed which government has shown this time is really remarkable and impressive. And another thing is ICMR, which is normally a quite, I would say, not very visible body, is taking a lead. Finance Ministry has worked very fast and declared the economic packages, and I think they are working on third lot of the packages also. So I would say that in spite of all the shortcomings that countries were not prepared, it has handled. Now the result was that states are largely performing very well, considering the size of the country, considering the congestion in the major cities. The numbers are quite well in control. The lockdown is slowly getting relaxed. This is another very good sign. Another good thing was that bureaucratic cholesterol, which clogs the arteries of the system, that has been reduced, and the trust deficit, which is quite against any government amongst the public, is quite reduced. So people are trusting the government, and there is good coordination between union government and the state governments. There is good coordination between the states and the various departments of the government of India. So I would say that so far there is no cause for mentioning that things are not as they should have been.
Right. So I think because we are talking today about pandemic preparedness, so therefore, in order to take our audience on the topic of preparedness, I think let us touch upon the idea of what is holding the fullest recovery, the quickest response. So let me first invite Dr. Taniru's response that what are the elements in the overall system. It could be the technical one. Of course, we don't have a vaccine as of now, where that's something which is most evident. A lot of universities are working on it. But nevertheless, in addition to that, there could be a variety of elements, including those which belong to the system or medicine or companies or government. There could be a variety of elements which are holding us back, holding the recovery back, or the response is stronger. So, Dr. Tanniru, will you give us a sense of what are those elements?
Well, generally speaking, anytime you actually go through these pandemics, one of the first things you need to understand is that these things don't happen very frequently. And, we are somewhat used to maybe epidemics because we kind of know how to deal with some of these. And, there is, of course, some definition of what epidemic is and what a pandemic is. And, if you look at some of these, we have done some good things over the period of time as we evolve. But the reality here is that this is something completely new, and we have not seen this particular type of virus. And so for us to immediately come up with a new vaccine is unrealistic, given the fact that it is relatively novel and scientists have not seen this. And if you go back some of the early pandemics, I mean, each one has a significant impact globally, and each one has, obviously contributed a significant loss of life. But so I think the question we have to ask ourselves is, science is not going to suddenly come up with a solution. It takes time, and any time you're dealing with these pandemics, what you have to do is to more prepare yourself at something of this nature that comes very quickly, need to be looked at in the broader context, and then see what is the level of preparedness we have. And I don't feel that we can suddenly blame the scientists, say we don't have the vaccine, how come we don't have the vaccine immediately for us to address this, but recognize that we as society, we are used to a different lifestyle than we had maybe in the early 20th century. And we are much more global, we are much more mobile, and so any communicable disease, naturally, we aggravate it by simply moving the virus from one person to another. So we have to recognize that when something of this nature comes in, you have to give yourself the time to understand what it is. You have to figure out what we need to do ourselves as a society to limit its spread, and then be able to start thinking of, okay, what can scientists do? And of course, in a way, I think even though as a country we have not done a good job, but I think as a society, as a scientific community, I think there's a lot more collaboration and cooperation in getting some new ideas tested, new explorations being made. So I think we have to be patient. You can't suddenly come up with a new vaccine as much as we like, but I think we need to give them the time to actually test some of these things. And many of these things actually take several years, but they are expecting hopefully something will come within 12 to 18 months, which is a significantly short time. So I think, there is no easy cure or no easy solution to this. We just have to be patient. We have to figure out let the scientists guide our action, more or less.
Right. Dr. Tiwari, can I request you to provide us your reflection on what is holding us back? What exactly are the elements?
See, I would classify or put into three phases: relief, rehabilitation, and taking advantage of the opportunities. So right now we are at the relief stage, where even rehabilitation, etc., nobody is talking about, and there's no need to talk about right now. See, luckily India has a very strong legal framework to handle the epidemics of this proportion. We have a very old act called Epidemic Diseases Act 1897, which is a very simple four section act, which section 2 gives all the powers up to the state, section 3 gives all the powers to the government of India, and 1 or 4 are the residual sections. Then we have got a Disaster Management Act, which is very comprehensive, of 2005. Criminal Procedure Code is there, Indian Penal Code, and there were few amendments required in view of the attacks on the health professionals. That also has been done right now. Now, if we come to the relief measures, stage 1, the government has geared things very fast. There was initially shortage of the, say, facilities, hospitals, that has been taken care of. PPEs, personal protective equipments were in short supply, that has been taken care of. Test kits were in short supply, that has been now attended to. Now, if you see, the number of tests have increased, and in proportion to that, the number of cases have also increased. Now, dedicated hospitals have been identified in every district to handle these cases exclusively, and containment protocols are well established. Now, concerns were, as Professor talked, that there was vaccine development is one issue, one concern. But another concern is that these testing protocols globally have not yet been perfected. So today a case is negative, after 2 days it is positive, and after some time it is negative and discharged from the hospital. Then after 15 days you find he is again positive. So we don't know what is happening. Either virus is playing this kind of game, or the test kits were not as perfect as we expected them to be. Then this virus is also quite smart one. It is a very low intensity virus which doesn't allow body to fight back immediately, and the infection keeps on, others keep on getting infected. So it's, as a result, its infection rate is very high. By the time the system starts taking the person in the say for the medical support, by that time a lot of damage that person has caused because of this smart virus. And another thing which we were expecting to start coming up very soon, and that has started happening, is that a lot of clusters are now emerging, where from every cluster some 20 cases, 30 cases, 50 cases are coming out. Because if one infected person is left out somewhere, then he'll be infecting another 30, 40, 50 persons before he's taken to the hospital. So this is one problem. Second problem which happened in the, like you saw the cases of migrants, even I would say that aged, infirms and disabled are also not attended to very properly, because there is no reliable database right now, or there is no database right now in the country for the migrants, for the persons having difficulty, or self-employed people, street vendors, those who require support right now. And that is one area where we'll be coming back again in the rehabilitation and the opportunity phase. Then there was maybe the management of migrants and say the street vendors, etc., was not given proper attention in the beginning. That also we have learned a lesson for the future. Another thing I would say, that India also follows a very sturdy model of polling booth concept during election. And had we followed this thing for say random testing or for provision of civil supply, it would have been much speedier, because everybody knows where is his polling booth. He can go and get the himself tested, or get the various food items there. Now, another thing which we learned from this thing, as far as the people are concerned, I am talking about the lockdown phase also, that initially when there was complete lockdown, the delivery boys of the e-commerce companies left. Now when e-commerce companies are brought back, they are finding difficulty in getting things delivered fast, because of the huge demand, at the same time very depleted delivery boys which are available. So these are some of the things, but by and large, if you look at the curve, it has started say flattening,
Right.
And maybe after a week, what we hope that things will be much more controlled.
So before we go ahead and talk about the preparedness aspects, and I'm going to focus a lot on the corporate social responsibility aspect. I can see amongst the audience also presence of many distinguished leaders from the CSR space. Mr. John Alex, the CEO of Equitas, is there, and a couple of many others. I can see many important names in the audience. And to all the audience, may I request that please continue to provide us your observations, your reflections, your questions in the chat box, and we will of course take them up suitably in the course of our conversation. And I have an interesting poll also in this webinar, which I'm going to publish very soon, that Can corporate social responsibility or CSR play a decisive role in meeting the COVID-19 challenge? That's the poll question. We will continue to look at the polling results from the audience. But let me take the conversation ahead and invite Dr. Tanniru first. That you gave us a list of previous pandemics, so it's very informative. But also, I think we would like to know that what were the elements, what were the key ways in which humanity was able to rebound, was able to bounce back. Give us a sense that how that was possible in the cases of earlier pandemics. What is, I mean, based on that, we would then take you to the next question of designing good preparedness systems. But first, tell us how humans overcame them in the previous instances, Dr. Taniru.
Well, before I answer the question, first of all, I think one thing that I see from what I heard from the conversations thus far is clear coordination at the federal level and the coordination with the states is very important. And I think that's one of the key things that's missing in the US, because I think you probably heard quite a bit about the constant fights between states and federal and lack of coordination. And I think that is one of the key objectives in order for any virus of this sort that has not been seen before and you have no other guidelines to actually follow. So I think that's just a comment I want to make. And I think those countries that have coordinated very well from the federal and the state and by the way, if there is one thing I want to add here, I think businesses have done a much better job in helping in the process in US than the federal government, because I think they have taken a greater responsibility in providing the appropriate support to their employees and to reduce some of the challenges that employees had to come and work. Now they're trying to, of course, open. So I think corporate responsibility, I think in my view, is very critical in this stage, because they need to understand, because that's where employees get paid and employees work. In some cases, I think US has done a better job, even though we have seen some of the meat processing plants and others that are food supplies are actually being impacted, and that has been a source of concern. Going back to guidelines, I mean, generally speaking, you can prepare as much as you want. I know we have done a good job in various influenza viruses, and that comes seasonally because we know how to do with it. And this is one of the last pandemics we had, and actually originated from H1N1 pandemic in 2009. There are quite a lot of guidelines from CDC that put together what each one should do, what the patient should do, what the businesses should do. And so they have a very clear articulated guidelines. And of course, if we had followed all of them systematically, at the moment we recognize there is a pandemic, maybe some of these would have been more manageable. But the reality is, going back to the early question, public health is always in the backseat, more or less, compared to medical health, because public health is always non-visible entity, except when there is a pandemic or epidemic. So we really don't have the resources often to build the connections that we need to connect with multiple entities in the system so that we can communicate and coordinate information. Everything has to come from the federal government through CDC. And even though there are guidelines written, who is following them? So I think one of the things we have to learn, I guess, is not that we don't have guidelines and not that we don't have the mechanisms. It's just that we have to institute some systematic way of getting that information out as we come back out of this particular pandemic. So we know what needs to be done. It's just that I don't think we have created an infrastructure that connects all these multiple stakeholders so you can immediately evaluate what needs to be done and what needs to be communicated and how we need to be communicated.
Right.
And I'll stop there and continue the conversation.
Right. And you can see the impact of your information, that before your comment, I think there is a sudden change also now, but I can see in the poll how the poll is fluctuating. Like 92% people feel that corporations can make a decisive role in meeting the COVID-19 challenge. So naturally, the audience is also resonating with your observation that CSR or other forms of corporate action can be very, very decisive in meeting such challenges. Let me now take the conversation to Dr. Tiwari because he has led the CSR action in the state of Gujarat very, very effectively. Let me ask him, of course, CSR in India in the current form, in the legislated form, is somewhat new, but Gujarat has been experimenting with the CSR phenomena even before the enactment of the Companies Act 2013. So there is a bit of that. But let me also rush to add here that CSR in its substance is not new to India. Corporations have been doing it in different forms. Of course, now there is a very definite shape and reportings and action required from CSR. But let me take this question to Dr. Tiwari that what are his reflections and when how he sees, because as a career bureaucrat he has handled several similar situations. And please share with us what are the key elements of your recovery strategy, Dr. Tiwari.
Dr. Sharma, I would say that every disaster tries to gives us quite different rehabilitation approach and quite different approach thereafter for that area, and we cannot actually plan these things well in advance. I'll give two examples of one of Surat plague and second Kutch earthquake. Surat plague, before the Surat plague, we also used to treat Surat as one of the dirtiest cities in Gujarat. And as a result of the plague epidemic, the government took it up very seriously and as a challenge to improve the level of hygiene in the city. And very soon it became the best city in the state. Similarly, Kutch, I had worked in Kutch a long time ago, and it was back and beyond. There was simply no water, no even power station. There was one small power station at that time, no industry. And post earthquake, after earthquake, government took a very proactive relief and rehabilitation measures. Involved practically every stakeholder. Anybody who wanted to help, he was welcome, and there was a protocol available for utilizing his services. As a result of earthquake, we got a fantastic building code now in the state, and very ambitious industrial promotion effort was taken up. And today, Kutch is one of the major industrialized districts in the state. Similarly, if you look at the London plague of 1860, it gave us to the world the underground drainage system, which was not there before that. So we do not know where. Right now we are like in a GPS type situation. We know where we stand, but we don't know how and where we have to go ultimately, what will happen. But if you look at the CSR part, one thing which actually many of us are worried that the CSR guidelines of Government of India are becoming very restrictive day by day, as if the corporates are doing something very wrong with the 2% of the money and bring this thing, upload that thing, this you can't do, that you cannot do, can do. So in the present form, it will be very difficult for the corporates to leverage their CSR, resources for doing something meaningful in the area. Like if we look at the current situation, I feel that the migrants should have been better trained by their home states. Now, the home states have completely washed their hands of the migrants, and they are minimum wage workers who cannot withstand even 15 days of disturbance to their earning. Now, had they been better trained, these people would not have this kind of exodus of people would not have taken place. So there is a need to provide better quality and more improved training so that they start earning slightly more and can withstand such small shocks. Second thing is that database of, as I discussed earlier, various categories, various groups, and very reliable database has to be created, and that should be available to handle not only this kind of calamities and disasters, but even the normal situation also. Then agriculture value chain will be disturbed. Sorry. Right now we are just entering the Kharif sowing season, and there will be a lot of disturbance to the farmers. I think the value chain has to improve a lot. Something has started happening, like APMCs have been restricted to their say location, and buyers are now allowed to say buy from the farmers directly. But it requires a lot of other say improvements. Then there is a lot of technology, new technology will be coming up as part of the pandemic. If you look at the personal protective equipments, then you'll find a lot of testing equipments. Where we are talking about ventilators, practically every third company is coming up with some model of ventilators. So all these things have to be now say handed over to startups, and they have to be supported and nurtured a lot. Present CSR framework does not permit this kind of thing, that somebody having private initiative, even for the betterment of the country, he cannot be supported. Then even if vaccine is developed, vaccine production facilities are to be created. Their whole value chain, the whole supply chain has to be created. Right. Then another thing which is going to happen is that restaurant, cinema halls, aircrafts, malls, people will be quite scared to go frequently to these places, even after pandemic is over. So there'll be a need for creating a testing protocol for these places, and to certifying that this place has been checked, say 5 days ago or 10 days ago, and it has been found to be quite okay. So these are a lot of things where CSR can get involved and do. But the present CSR, the new rules which have been uploaded, are putting a large number of restrictions which all of us have objected. Maybe they have to look at these things again in the light of the pandemic, right, and modify it again. So yeah.
Right. So let me. That's very, very valuable, sir. We will get back to the question of preparedness, but let me on the question of CSR. Of course, that's very, very critical, because that provides a very swift response by the corporations. But let me take one more systemic question and pose it to Dr. Tanniru first. That what is his design? What is his model of pandemic preparedness? What can public health officials particularly do for a swifter recovery in such cases? And then, of course, all of you can see in the chat box, there are questions which we will take up in due course. But let me first invite Dr. Tanniru's response to that.
Well, I don't know whether there is any quick recovery that one can plan on, because I think this is something that we have not seen before. The impact of the magnitude for this type of global society we have not seen before. So I don't think we can ever think of a quick recovery, but I want to go back and address one point that was made just last. One thing we always have focused on is big business, but this particular pandemic, because it affected the mobility of the people, and most of the people go to restaurants and movies and coffee shops and wherever that they normally spend a lot of time in. The service industry, the people that actually service the people, that particular segment has been the least prepared, and government has been very ineffective in supporting that community. Like mass transit, New York seen a significant amount of virus deaths because people have to go long distances to get to work. So if we ever going to prepare anything going forward, and if communicable diseases are going to be the challenge, we really need to think about not just big business supporting employees and creating spaces, but address the service industry, because those are often the people that can least afford disruption in their life, because they don't make a lot of money. They have to transport themselves through long distances through buses and trains and others, and they can carry a lot of these viruses much more easily, and you can't blame them because they got to get to work. So if I can see the number of people that are affected in US, and I'm sure globally, most of the people that died are people that have low health inequity. They did not have the health that we relatively well-off people have, and they have to work in an environment that is not as conducive for some of the separations we want. So if there's one recovery that we want to have, and I think that's one of the key objectives going forward, let's start thinking about the basic needs. You know, it's one thing to have a comfortable place and a home and all that, but there are a lot of people that are struggling to get the food they need in order to put the roof on their head, put food on the table. So let's revisit the basic needs of the society and look at what are the individuals that are need the food security and transportation and some level of comfort. So maybe we need to address that first and then start addressing some of the others. So if I have to look at any kind of recovery, I want to start the recovery at the bottom end of the Maslow hierarchy, because societies, you can address some of the broader objectives of empowerment, and as he mentioned about creating new innovative ideas to provide opportunities for entrepreneurs. But let's start recovery at the basic level so that all the service industry that is decimated, and of course in US, it's all the minority populations, they need to be addressed first, and they need to have the ability to do what they need to do before we can start addressing some of the others. And I guess this is more of a last summary of what I was going to say. If we use this pandemic as a lesson, maybe some of the pandemics, I have seen H1N1. I have at least got exposure, not exposure to, but at least I've seen SARS. At least I've heard about some of them. But they never impacted my life, and of course, a lot of our people's life. This is the first pandemic that's actually got the attention of almost everyone in the country, as well as I'm sure in the world. So we really need to rethink about how we make public health policies, how we connect the public health to the clinical health, so we can develop the resources for immunizations as well as recovery of the patients. Let's connect using digitization. We already have a lot of technology, mobile phones. Let's use the digitization to communicate to consumers, to share information on where their needs are, how do we address those needs directly through the employees, through the government. And also let's engage more people in the system, not only corporations, but the schools and the restaurants. Let's create more of a network so that we can leverage multiple resources, because no federal government or state government can do everything. Even corporations can't do everything. But we really need to think about connecting, and we have the technology to connect all of these. But if we are to go forward, we really need to rethink public health should be a personal health. It's not something that comes in whenever there is a pandemic or epidemic. It has to be something that you need to touch individual and what their concerns are. How do we take those into account in developing policies as well as practices to not continue the same kind of disruption we have seen? So I'm hoping anyway, because of the level of disruption we have seen, that maybe we wake up to this. And to some degree, public health is all about government, because that's usually where the government puts money in. So we need to rethink about not just the hospitals that provide care for the sick, but think of public health in a longer sense and try to develop some strategies to address that. So that's really my perspective, especially since I started in public health after spending 40 years in business and IT. I feel like public health needs to retransform itself to become a more connected mechanism to connect health to the individual. I'll stop there and then
Before I return to Dr. Tiwari, I'm tempted to ask you, Dr. Tanniru, one question which is hanging in the chat box from Taskeen Zaidi. And what do you think? What is your estimate? When do you expect the normalcy to return? When do we have the return of normal life?
I don't think anyone can guess that, because I think, everyone is suspect. Everybody is afraid. I think the big challenge really is testing. we don't know who has virus, who is going to communicate that virus to somebody else, and we don't have the testing equipment that is reliable. So I'm not expecting normal life for another year at least. It may come slowly, it may come in different arenas differently, but I think it's too optimistic to suddenly flip a switch and say, okay, we're going to be normal, because the disruption in the society is too dramatic and there is so much concern that I don't think we'll see the type of normal life for a year at least, in my view.
Right. Let me now turn to Dr. Tiwari and invite him to give us a perspective of from the government side, because we will come to the corporate action side in a bit. But let us first focus what can the central government, the federal government, and the state government do in this situation. You have a wealth of experience, so give us some nuggets as to what can already you have given us a glimpse of what the central government and the state governments are doing, but we want a bit of a distilled version of your experience, that what governments can do in order to have a swifter response, in order to have a swifter recovery.
Dr. One, there are two things. One is that our conventional model of handling any disaster in the country is relief, rehabilitation, and reconstruction. That's the standard model. And right now, government is into relief way. That first is to contain the calamity and try to see that people are least affected. That's the object of the phase one. Now, if we look at the one major tool right now which we are having to battle this pandemic is the lockdown. Now, lockdown has affected the poor people the hardest, and actually they are the people who are always the worst hit in any pandemic. They need cash. Some cash has been made available to say in various states. That central government has also provided something, and something has come from the states also. Now, the lack of database will be created a major problem, that who gets and who doesn't get it. Second category which requires a big support is the self-employed people, whether they are the white collar one or the blue collar one. We know today households are running without maid servants. Now, what is happening to those maid servants right now? Are they having enough to eat? Are they getting medicines? If they are having some special child inside the home, or some old age person who requires medication, there is no idea, and there is simply no record. So, and this was one thing which has been where, in fact, for rural areas, we have got very strong database. For urban area, this was in the process, but so far it's not very reliable. Then we come to the agricultural side. Because of the transport chain which was impacted, farmers, especially the vegetable growers, the onion growers of Maharashtra, they had great difficulty in sending the material to the markets. If it goes to the market, there are no buyers right now. So agriculture has been very badly impacted, and there are even UN warning about the food crisis which may take place because of this. Another major thing which we heard just now, that we don't know who is infected, who is not infected. Now, there is a tremendous distrust. You don't trust your neighbor, whether he's infected, whether he's spying on me, and if I'm moving outside my house and he goes and complains to somebody, or I had some visitor from abroad and he goes and complains to the authorities. So this pandemic, unfortunately, is now showing us the base human nature, where everybody is for himself. Now, one area where government has to take very some active measures to give a comfort, level to the people, that poor are well attended, the migrants are well provided for, and the agriculture will be taken care of, and there is nothing to worry right now.
Right. Then my follow-up question to you, Dr. Tiwari, again is that, I want your full attention on the CSR You have given us some preliminary remarks on that. You have said how CSR regime is working, what are the new things which can be done. You have given us preliminary remarks on that, but I want to spend some time on this question of CSR playing a critical or decisive role in assisting the government in meeting this challenge. So, how can corporate action, because companies have multiple roles, those which are providing, which are producing pharmaceutical goods, those are producing medical services, those are producing testing or diagnostic services. There are all these are done by companies. And then the second part of the corporate action is that in India, at least, they have a mandate. Companies above a particular threshold are expected to spend 2% of their money in accordance with the spirit of Section 135 of the Companies Act. Now, the issue is it's not the money, perhaps. To my understanding, it's the entrepreneurial spirit. It is the ability to organize things which, if that comes forth from the corporates, can can really play a great role. So please guide us how that can come forth and play a decisive role in such situations. Dr. Tiwari.
If you look at the CSR, total CSR funding available in the best period in the country, never exceeds 16 to 18,000 crore rupees in a year.
That's
Now,
right.
it's not such a big amount which can say start supplementing the government efforts and government schemes in a say even a normal situation. To give just one example, the budget of Gujarat Education Department is something like 30,000 crore rupees, which is much more than the total CSR spending in the country. Now, somehow the Ministry of Corporate Affairs is trying to pool this money for the government efforts. Like we have seen various measures where they are trying to pull this. When we were designing the Gujarat CSR Authority, our approach was that CSR should be a venue where we pilot new initiatives, new ideas, we create some proof of concept, document it properly, and pass it on to the government for upscaling or to others for scaling it up on a larger platform. And any new opportunity which is more risky, but which government should not take up right now, can be tried in the CSR, where you had all the flexibility to plan and design. If we look from that perspective, this pandemic is throwing a lot of new opportunities. Like there will be a lot of clinical equipments and PPE, as I mentioned, etc. Right now, will be emerging. Why we have to import these simple items from China or from other countries? Can we, through CSR, which is anyway the sort of a venture fund, can it be treated like a venture fund and it can initiate some startups to start, say, manufacturing state-of-art or very high-quality equipments with proper testing, etc. Rather than, see, today if you ask anybody to do anything in the government sector, such things, they will say, okay, the self-help groups of the poor women can be organized for doing these things. That's not the solution right now. Or another thing is that we saw the way drones were involved, were deployed in a very innovative manner by the police department, state governments, even by the bootleggers or people who were supplying tobacco, etc. Everybody in a very innovative manner, drones were deployed in development purposes. I'm not talking about the defense in the espionage purposes. Now, can we take up drone as a major thing and create a large number of drone entrepreneurs? Now, if you think about even the spread of pesticides through drone in the country, there will be more than 50,000 employment, say, drone entrepreneurs will be required in a small level. So we talk about e-commerce. Now, can e-commerce link the small kirana shops? Now, kirana shops are going to be in a great difficulty after the pandemic. Now, is there a way to link the kirana shops with the bigger e-commerce players? And can CSR try, say, CSR funds be used for this thing? Like e-learning is going on very, say, in a big way. But if you look at the approach, it is the similar classroom approach which has been transferred to the, say, internet. Can it be converted into something like a serial film, or say, with the proper editing, proper script writing, etc., which is more professionally designed by using the CSR money? Or why we have something like Dharavi slum in a country which wants to, say, play the global role right now? Can there be a better slum development approach and better town planning approach for to that within 5 years we just remove the Dharavi slum? Or even personal hygiene, lot of new say ideas, new products will be coming up. Can we create good quality entrepreneurs by using CSR money? Similarly, what we perceive that packaged food will be more preferred right now rather than going to restaurants. Now, I have seen in the villages, rural area, the packaged food has penetrated very, say, strongly, but the quality is very bad. And they are looking at the 5 rupee, 10 rupee price band, and the quality is not as you will require. So these are a lot of opportunities are now coming up for improving the quality of life. Quality of life doesn't mean that you spend on education and the school teacher, primary education, and say primary health centers only. There can be, and CSR funds can be used for more experimentation. And for this, the MCA has to look at their draft guidelines, this rules for the CSR rules, which they are going to announce very soon, and they have to relook that and create some avenue for say better quality CSR.
Right. I think there are some very interesting questions. I'm tempted to take those now. So there is a question to Dr. Taniru. Mr. Alex is asking the big question. Of course, you have, in some sense, you partly have answered, but nevertheless, let me again ask that question. In your views, what is the prediction on a cure and also a vaccine which could only give us confidence to recover quickly from the crisis? Do you have any sense of that?
That's a $1 million question. Everyone is asking, when is a vaccine going to be? Well, I mean, there are trials. There are different type of drugs that are being tested. Actually, FTC in the US is trying to speed the development and or clinical trials much faster than normal. But I think the best estimate that everybody says right now is probably sometime next year, but I don't know when. And so the question really is, until we have a vaccine that is reliable, clinically tested, I don't think people feel comfortable to come back to the life that they have. So that's one reason I said it may take about 18 months or so before a vaccine comes in, and maybe we can start using that to come back to a life that we're used to. But that doesn't mean we have to stop. I mean, I think there are chances that may come sooner, but there are things we could do much more effectively. If there is one thing we learned, we can do online learning much better than we ever thought. We can do social distancing and contain some things and still have a social life. So there are things we learned through this crisis that we could leverage to continue our normalcy in maybe in a different normal. So I won't expect a vaccine to come this year, at least in my view, and maybe early part of next year. That's our best guess from what I read here. So
You will have to
let's not hope on that. I'm sorry.
You will
Go
have
ahead.
to continue in the role of a future teller for one more question.
Sure.
When do you think COVID-19 is likely to peak in the USA? That's a question coming from Dr. Govardhan Saini.
I'm sorry. Can you repeat the question? When?
Dr. Saini is asking when COVID-19 is likely to peak in the US.
That's a big question because every state is different in US, which is kind of unusual because there is no central coordination. So New York may hit a peak pretty quickly, according to most of the estimates. And then, of course, Louisiana, then Illinois. So I think everyone is doing this in a slightly different way. California is getting better at it. So I don't really know when we feel like we hit the peak, because the US is not a small country. It's significantly diverse and states are different. So I think everybody is expecting the middle of the country to actually not even get to the peak, because all the rural areas are actually suddenly seeing the impact, especially the food industry. So I don't know. I mean, every, like Georgia, Atlanta is starting to become open up again, even though they haven't reached the peak. So I think states are kind of acting like wild, wild west right now in US, which is unfortunate. But I'm hoping sometime by the end of this year we should hit the peak everywhere. But again, that's a guess. But again, there is a question that we may get a second wave and a third wave, which actually coincides with the flu season in December or November. So, and as Dr. Tiwari mentioned, this particular virus is mutating in unusual ways, so it may stay with us for a while. So I don't know what a peak is anymore, because it's not a clear virus that actually goes up and comes down, because it may take different forms. So I think it's a little bit of a guesswork. So I don't think
Right.
we plan for contingency for a while.
Right. And Mr. John Alex has provided us a very important question. Dr. Tiwari, how, small businesses which are already disparate, because they have to balance a lot of things. And so they have to, of course, ensure the continuity of their business. And on the other hand, they have to also see that how the employment of people who are working with them, that can continue. And of course, the situation is not uniform across the sectors. It can vastly differ from sectors such as agriculture to other sectors. So how can small businesses strike this balance? How can government help them? How can big business help them? Can you put things in perspective on that, Dr. Tiwari?
See, unfortunately, the small businesses, and at the same time, I'll add to that list the MSMEs. They are going to be hit very hard. The way we have relied, and it was necessary to rely on e-commerce, which had the capacity to deliver goods to the household. That means that the problems for the say kirana shops and other small businesses will actually become more serious. One way is for their suppliers to give them a longer credit period, which is possible provided the banks give the longer credit period to the manufacturers. This is the standard pattern in the trade and commerce, that you demand for a larger credit period. Say right now it is suppose 45 days, so it may be extended to 90 days. By that time they will be able to provide the money. But there will be a lot of failures also. Small businesses are going to be very badly hit. So those who fail, they do not repay the money, the credit which they had got. So who is going
Right.
to pay for them? I believe that in the next lot of say economic package, something might be coming up for them, especially those who are registered with the local authorities. This will be one area. And I also perceive a very serious wave of bankruptcies in the MSMEs, who are being hit from both the sides. From their suppliers are refusing to give them the supply, and their buyers are refusing to give them the money which they owe to them. And there will be a lot of bankruptcies in the MSMEs. Now, USA has a very simple bankruptcy code. India tried to follow for the large corporates, but we find that there will be this delay of 3-4 years to get it resolved. So resolution speed is not very high in the current mode. Maybe a simpler bankruptcy code has to be brought into force or has to be designed for the MSMEs. And obviously, again, the getting longer credit period will be one way. Second thing, which I don't know why it is not getting popularized, and there was some private initiative, that if I am a MSME and supplying to a say Fortune 500 or India Fortune 500 company, which is having A+ credit rating, and they have to give me money back after 30 days. So why I am being rated for that, to take credit on that money which is legally stuck at the big corporate? At my credit rating, I'm borrowing money from the banks at 12 or 13%. But that money is going to come back from a A-rated company, which normally gets a credit at 8%. So I should get the say working capital for the money which is blocked at the major say buyers at their credit rating, and I should get a cheaper interest rate on that. If this kind of logic is followed by Government of India immediately, then there'll be big breather available to the MSMEs and even the shopkeepers.
Right, that makes eminent sense. And the second question is again to you, Dr. Tiwari, coming from Pallav Raj. Should there be any separate strategy that can be implemented in the highly impacted states such as Maharashtra, MP, Rajasthan, Delhi, and Gujarat? Do you think we need a separate strategy for these states?
I would say that I don't know. I have not thought about this part. But if we look at the impact, like even if Gujarat was impacted, say slightly bigger, more than other states, but the migrants and the wage laborers, they had come from other states. Bihar and UP or Odisha are badly impacted because of the Gujarat problems. And the kind of the numbers of people who have gone there, and they are being, say, supported by their state governments right now. That's a big problem. Although Bihar may not be citing having the number of cases, but if you count, I don't know, I'm just talking about the ballpark figure. Something like 10 lakh migrant laborers might have in some way returned to the Bihar, or they may be stuck somewhere, maybe in Surat or other places. So the way this was a pandemic having global repercussion, it has a pan-India repercussion. Every state is in some way impacted.
Yeah. And in these situations,
so they can't. I don't know how there can be a different strategy for the highly impacted states.
Right. And in these states, I think you have given us the answer to the question also that which Mr. Raj is asking: what can corporations and NGOs do to align with the government strategy and increase efficacy to contain the spread? Any further pointers on that? Corporates and NGO, what can they do?
See, I believe right now when there is lockdown, the corporates and NGOs cannot do much other than contributing some funds, which they have already done in, say, quite a big amount has been donated by them. Right now, there is to run the kitchen, etc., for the people who cannot afford, and that is already happening in a good number. And I think CSR funding was not required. I think local philanthropists have pooled their resources and they have done it. I think the CSR and corporate support will be required in phase 2, or from there they have to pick up and start, say, taking over. Right now, when everybody is under lockdown, we cannot do much right now. We cannot go and support the agriculture. I'm involved with few NGOs, but their people are stuck at their head offices. They cannot move in the field right now. So even if money comes to, say, NGOs or other, say, implementing organizations, there is no way for them to spend this money. Another thing which is happening, that there are a lot of CSR supported hospitals and health facilities which are anyway being used by the say district administration for managing corona cases. I'm involved with another, say, 2 hospitals who are involved in this way, and they are providing all the support. Now, I was talking to one of the district collectors that what all you require right now. So rightly, his requirement is he requires a large number of doctors and nursing staff to handle. But today, getting a doctor in this situation, no state or from nowhere you will get the doctors, right? Whatever you are having, you have to manage with that. So see, the current phase is this such where the government has to do whatever is required right now in the relief stage. Unlike the earthquake, where people can go and start participating in helping in the relief measure, here in case of epidemics, it's not possible.
Right.
So the corporate hospitals are the only way which can be, say, involved. in the health.
Correct. And that brings us, because we are also approaching, we have also already crossed the time limit. That brings us to the closure. And let me invite closing remarks by taking one more question from Neha Joshi Jain, that when will schools abroad be open to welcome Indian students for international studies? That's a question which I think you can answer, and also provide us your closing remarks. To Dr. Taniru first, to you.
Well, I think there is a significant, obviously, you have seen what the president has said about immigration, but besides that particular politics of it, I think, with online education suddenly becoming a routine now in many US institutions, which, in the past have reluctantly accepted online as maybe an option rather than a potential natural extension of their educational model. Maybe with online education, maybe universities could continue to admit foreign students, but maybe for during this pandemic period, do it online, and then maybe after pandemic thing settles down, maybe next year have them come here. So maybe there may be alternative models on the education side. Again, I'm not yet fully cognizant of any strategies for recruiting, but I know University of Arizona recruits a lot of international students, and I know that there is a push towards more online. So I think that is going to be a model. I don't think it's going to be less on the student admission side, but it's really more of how that is going to happen. I think that's we have to wait and see. But I just my summary thought is, if one thing we learned through this pandemic is when something of this magnitude that impacts every part of the society, you cannot have a simple central government solve all the problems. You really need to identify and distribute the responsibility to local entities and give them the resources so they can address the needs more effectively, whether it is through CSR funding that you mentioned, through corporate and nonprofits, through states given the charge so they can actually address this. And also, more importantly, I don't think you want to put one state versus the other. You really want to look at the needs of the population at various segments of the economic society, service industry, small businesses, so you have different industry has different complexities, and you need to address them whether it's New York in US or California or somewhere in rural area. The service industry, it has to support people. So how do you address them? So I think we really need to go back on our economic ladder and say, what are different types of industry, how they can manage in these type of conditions, how can they recover, and then how do you develop strategies, and who actually becomes responsible for supporting them. And more often than not, it should be localized entities rather than central government. You can't rely on federal government to control everything, but you got to have the federal government at least give the responsibility and the resources to the local entities for them to bring it back to some level of normalcy. That's
the call. Local action. I got it.
Local action.
Right. Dr. Tiwari, your closing remarks, including your remarks on the education sector.
I think about education, I have slightly wild ideas because I feel that the way Indian education system has been handled, I think it is doing nothing great to the society. I would say that this is a great opportunity to start shifting towards e-learning, as Professor has also mentioned. And can we say that schools will run, even if schools don't run for 5-6 months? Can we manage through e-learning? I think with today's technology, it's possible. Now, can universities and schools start having the say online examination and online say certification also, without seeing the face of the student? Now, look at the benefits. It will save so much of money of the students in terms of hostel or their food or their say movement, etc. They'll just stay with their parents and pay the tuition fee and get the certificate or degree. So I think this can be a major opportunity to get rid of this reservation about the e-learning and take it very wholeheartedly.
Right.
So I think that
No, I
I
think
would like you to
I
think
think,
on
sir.
these lines.
I think, sir. I think, sir. We have to willy-nilly. We have to come to that. We have to experiment. We have to accommodate new ways of imparting education, new ways of acquiring knowledge, new ways of acquiring skills, new ways of acquiring experiences. So I think that's something which is the way forward. And as a closing remark, I can only say that 92% people feel that corporate social responsibility has the potential to play a decisive role in meeting the COVID-19 challenge. I think that's a very, very overwhelming mandate to CSR, and I'm tempted to consider probing this question much further, much deeper, and perhaps write a little bit more on this. But thank you very much, Dr. Mohan Tanniru, Dr. A.M. Tiwari, and all the distinguished, we have about 60 participants who are heads of CSR committees, CEOs, senior functionaries of CSR, senior functionaries from academic institutions, students, a very, very wide variety of audience. Thank you to one and all. It has been a great time, and we have had a very productive discussion with both of you. Thank you very much.
Thank you.
Thank you.